The research track is a dedicated period of time between your third and fourth year during your residency here. And what it is essentially it's a track where you become a surgeon scientist.
It's an opportunity for them to really hone their research skills and take an additional year during their training to focus on pursuing a research question that leads to a foundation for an independent, successful research career.
The wonderful thing about the track is we have the ability to create whatever you want during that time. You can be an international scholar where you learn how to do science that's specific to international orthopedics. You can be a true basic scientist. You can do translational research. It really is whatever you want to do to create your own academic track.
It starts really when the residents are in their first year, and during that time they're really presented with sort of a buffet of different options, research options from various labs spanning over a dozen different departments across UCSF. During the first year of the residency, residents are encouraged to meet and talk with PIs of various labs, both within orthopedic surgery, but also outside orthopedic surgery, and to identify project areas that they're interested in.
So what's unique about the UCSF track compared to other tracks is the diversity in research opportunities. We have experts in patient-reported outcomes, international health, basic and translational research, imaging analysis. We have experts across the field in all the subspecialties, whether that's trauma, sports, pediatric orthopedics, hand, foot and ankle. So whatever you want in terms of developing your academic career, we have it here.
But in addition to the training opportunity, it also provides educational opportunities in the forms of grants and seminars and conferences, and also mentorship opportunities.
We have the people that will train you in how to write grants, how to develop proposals to work with industry, to work with small companies, to work with the NIH, to work with groups like the OREF, AOSSM, trauma, so that you understand how to write proposals, papers, and be successful at all the different stages of your career. The 6-year track, even though it is an additional year of training, really does set you up for success.
I'm Dr. Michael Davies. I'm an assistant professor in the Department of Orthopedic Surgery here at UCSF, and I'm a former participant in the 6-year research track in residency. As I was choosing residencies, I already sort of had a goal of eventually, long-term, being a clinician scientist within orthopedic surgery. So I was really looking for a program and a track that would allow me to kind of build those fundamental research skills in addition to the clinical skills that we all need as orthopedic surgeons to set me up for a successful academic career. I recognize that the research track is much more than just 1 year that gives you extra time to do research outside of your clinical duties. It's really 6 years where you get that extra mentorship and training that you need to eventually, hopefully, be successful in building your own research program. It has to be more than just dedicated time to try and write and publish a ton of papers. I would want potential applicants to know that, our department and really the broader medical system is unique in terms of the breadth of resources that we have for being able to accomplish really whatever type of research endeavors you could think of. This really is kind of a mentored pathway towards an academic career in orthopedic surgery. And so if that is what you think you're looking for, this is an excellent way to kind of get from point A to point B.